everybody, it's Dan Sfera, www.theclinicaltrialsguru.com. I'm here with my dad today, and my dad is a psychiatrist, and he does a lot of clinical trials. And since we were talking with Dr. DeRosa and Don Walters about the placebo effect, they had a very interesting discussion, and they asked me to get my dad's opinion on it. So, Dad, can you talk a little bit about what the placebo effect is for those people out there who may not understand what that means?
Yes. Almost with all the medications that we know about, we have the placebo effect, which scientifically we know that it's mediated by the opioid system. So, which means that mainly when I expect a positive response from the medication or from a psychotherapeutic approach, I would have an increased production of endorphins, which in turn mediate the placebo effect. And with most of the medications that we use, we have about 30% of the placebo effect. What's interesting is that there are studies that show that the placebo effect can be stopped by using opioid antagonists such as naltrexone. Because of this, we know that this placebo effect is not only a psychological effect, but it's actually mediated by neuropeptides such as opioids. For some of the psychiatric disorders like major depressive disorder, mild to moderate only, it was found that the placebo effect can be as high as the therapeutic effect of the SSRIs. But I have to mention that it's only for mild and moderate major depressive disorder. Another thing is that major depressive disorder is a self-limiting disease. So even without any medications, the patients would not stay depressed for a long time. So it all depends on when the medication started to be used.
Okay. And a lot of people out there who may be considering clinical trial or maybe did a clinical trial before, they need to understand that the drug companies usually give you very clear instructions not to provide therapy to the study participants, right? In order to not cause a placebo effect to occur with the placebo. They want to see a difference between the study drug and a placebo.
Right. We generally avoid doing psychotherapy with the subjects of clinical trials, but there is one aspect of it that is still a placebo effect, like the patient coming to the office and seeing the staff, whether that's the physician or the auxiliary staff, and being asked, how are you doing, and how are things going. That's a placebo effect too, because it's attention being given to the patient and being listened to. So I think in some aspects you cannot avoid the placebo effect completely. However, you can minimize it by avoiding direct psychotherapy to the patient.
All right, so that's Dan Sfera from www.theclinicaltrialsguru.com, and any questions you can email me at dan@theclinicaltrialsguru.com. Thank you.